It's really to help the patient get rid of some of those areas that they're unable to get rid of on their own. The abdomen, the waistline, and it's the areas that we want to see improvements in the contour of the body. You can remove fat from the arms, you can remove fat from the thighs. The goal is to get a better aesthetic shape on the patient that really, when they look in the mirror, they see a better result. Yes, liposuction can be combined with other procedures, including breast augmentations, fat transfer, tummy tucks is really the most common with it. The intended results of liposuction is to achieve a better aesthetic shape, so something that the patient really wants to look in the mirror and just see that small change, sometimes large change, but sometimes it's just enough to make them confident in what they're seeing. We really just want to, a lot of times they're looking for that Coke bottle shape. It depends on the amount of areas we're doing, so it can be as quick as 30 minutes and it can be as long as 2.5 to 3 hours, depending on the amount of liposuction that we are doing. The ideal candidate for liposuction is a healthy patient, and that can vary in age, anywhere from 18 years old up until even I've liposuction patients in their 70s. It just depends on the health of the patient. Someone who has good quality to their skin is the best patient, because if they have too much loose skin, then there's other procedures that we would talk about. Someone who's a non-smoker, someone who treats their body well, eats healthy, takes their vitamins, and someone who's not too overweight. It's okay to have that excess fat, that's what we want to remove, but someone in that range. We initially like to do a full workup on the patient. We want to make sure that they're healthy to go through the general anesthesia, so we usually get blood work done to make sure they're healthy. Depending on the patient's age and health, we will sometimes do some studies like EKGs to make sure that their heart is healthy. And I usually tell patients to just eat healthy. I want to see them with a high protein diet because that will help with recovery. And just staying away from smokers, especially not smoking themselves, and really just treating their bodies well. Recovery time for liposuction really depends on the areas and the amount that we do. So if I do a full lipo 360, that's usually in the range of about 1 to 2 weeks. If I do just maybe a lipo on the abdomen and a little on the waistline, maybe a week or so or less. If I just do some lipo to the arms, maybe even just a couple days. So it really depends more on the areas of the body that is done. Initially, they're going to have some pain, but we will provide some pain pills, and that will really help manage their pain. They will notice some drainage from the liposuction fluid that's placed initially. The full results from liposuction can be seen as far out as a year. They will see the results immediately, the same day, the next day. However, at first they will have a lot of swelling, so it's good to wait a few weeks to really start looking at the final results. Especially 6 weeks, a majority of the swelling is down. However, the skin tightening will begin and can last as long as a year.